With me is Dr. Daniel Raza. Sorry about that. He is the chair of Canadian Doctors for Medicare and a family doctor in Toronto. Good evening to you, Dr. Raza.
Hi, Carole. Thanks for having me on.
We have lots of your questions to get through, so let's get right to it tonight. Our first question comes from David Dominic, and he tweeted, "What are the benefits of a national Pharmacare program?"
Yeah. I mean, I think that's really where to begin, right? Why are we having this conversation to begin with? Well, I think Hannah did a great job of outlining the problem that as it exists today. We have 1 in 10 Canadians who aren't able to fill their prescription because of costs. 40% of Canadians who don't have a drug plan. I'm a family doctor involved in frontline care, and when a patient comes in and I write them a prescription, the public plan, essentially Medicare, essentially ends when they walk out of the door. And there are times when I have to actually, ask them and think about, what is the coverage that they may or may not have for prescription drugs. And it can actually limit my ability to be an effective physician and care for my patients.
In what way?
Well, if a patient comes in and, they don't have a drug plan, they're paying out of pocket, they don't meet the public eligibility, they don't have a good enough job for a private plan, and I'm writing a prescription medicine to treat their, their diabetes, their infection, or whatever it may need, a medication to make them feel better, and they can't pay for that, then, we have to search for a secondary option that's maybe a cheaper drug, but maybe not as effective, but it's, they can afford. It's really limiting the therapeutic options that we have available.
Okay. What about the downside to introducing a national Pharmacare program?
Hannah said off the top, we are the only country with a universal healthcare system that does not include a universal healthcare program. When Medicare came to being in the 1960s, we covered hospitals and physicians, but not prescription drugs that happen outside of the hospital. And it's taken so long for us to get to this conversation. I mean, in my view, the downside is that we're not there yet, that we've had Medicare as it exists today for 50, almost 60 years, and this still remains a huge problem.
Okay, Daniel Good is concerned about the cost. Have a listen.
It'd be good to actually have some kind of form of proof or action plan of what's he going to do about it. Who's he going to charge and how is he going to get this money? These are all things that be good to know if he actually told us.
Okay, what do you think?
Well, that's a great question. A lot of folks are wondering about costs. The good news is we actually have a lot of research from multiple different sources to inform us. So we heard from Hannah that we had the Advisory Council on the Implementation of National Pharmacare release their report this summer. The Parliamentary Budget Office released a report last year. We've had reams of report come from the peer-reviewed medical literature, and they all are saying the same thing, that if we move forward with a universal public plan, we can actually reduce spending on prescription drugs anywhere from $4 to $7 billion, right? That's really substantial. That's a lot of cost savings. And we'd essentially do that by eliminating private spending on drugs. Now, it is true that would mean a small increase, a modest increase in the amount of public spending, and that money has to come from someplace. So it is absolutely important that the political parties also put forward revenue tools to do that. And folks have put together different proposals. We've heard some people propose wealth tax, other people propose other things.
Mm-hmm. But co-pays are included.
Co-pays,
or is that going to come anyway?
I mean, that's a small copay was included in the Advisory Council.
Up to $5, I believe.
Yeah, but I think it's important to point out with copays is they're actually really expensive to administer, and sometimes it can actually cost as much to administer the copay as the revenue you collect from it. So if you're interested in generating revenue, copays are not a particularly efficient way of doing it. I think when it comes to paying for this, I think it's really important to understand the extent of the cost savings and also who's going to save this money, right? Because we're not just talking about individual Canadians and households whose spending would be substantially reduced. We're also talking about businesses, small and large. Small businesses, big businesses are facing increasingly expensive prescription drug plans. They're having to decrease the benefits that and a number of drugs that are covered, or they're increasing deductibles and co-pays. It's a serious cost of doing business. And if we take those off of the books of employers, we're actually giving them a very indirect subsidy to increase their competitive advantage. It's actually, you can look at it as a boon to the economy as well.
Okay, Eric Harvey asks over Facebook, Will the Pharmacare strategy cover prescriptions for people on a disability pension? Do any of the parties cover this?
So this is the beauty of a universal public prescription drug plan. We heard earlier that there's over 100 current public plans. There's all of these private plans. Otherwise, you're paying out of pocket. When you think about a universal public plan for prescription drugs, it means it covers everybody, just like doctors and hospitals. So when you go to a hospital, when you go to the emergency department with a heart attack, when you go to your family doctor to have your blood pressure checked, you're paying nothing when you check in. You're presenting your health card, and that's it. It doesn't matter if you're on a disability pension. It doesn't matter if you're a university student. It doesn't matter if you're a Bay Street banker, right? It's simple. Everyone is covered. There's no complicated paperwork, regardless of your status.
Okay. Paul Kent tweeted at us saying he is concerned about unnecessary drug costs. He asks, what is the plan for keeping doctors aligned with the pharmaceutical lobby from introducing unnecessary drugs and costs into the system?
Yeah. So the good news is that's already starting to change. Right now, we have this fantastic national program that's called Choosing Wisely that's pushing physicians to more appropriately prescribe medication. So for example, when someone walks into your office with a viral infection, they don't need antibiotics. So it's emphasizing those sorts of interventions.
Like opioids as well, I think,
Exactly.
is what's on people's mind.
Yeah, I mean, as it should be. It's a national crisis. The value add of a national public pharmacare program is you can develop a single list of, or a single formulary of medication drugs that are selected based on the best available evidence. So the prescriptions that are being prescribed are safe, they're appropriate, and they're the most effective alternatives that are available.
Okay. Kay asks, will there be a national formulary to require that provinces do not have massive differences in which drugs they cover? And she's asking for all of those who are promising, from all of the parties who are promising this kind of coverage.
Well, Kay, thank you for that question. It follows very nicely from the last one. So even though we heard earlier that the Liberal plan today is a bit ambiguous, the one thing that it does have in common with the other plans that we've heard, and
the NDP and the Green.
Exactly, is that they all propose a national formulary, so a single list of drugs that everyone would be potentially covered. So whether you need a prescription filled in New Brunswick or Manitoba, or Ontario, it's from the same list. And actually the news that's even more encouraging is we actually already have the underlying infrastructure to do this. We have national agencies like the Canadian Agency for Drug and Technology Health Assessments. It's a mouthful, but they are already doing this sort of analysis for the provincial drug plans. So a national plan would actually create an opportunity for all of this work to be consolidated.
And our final question tonight comes to us from Sarah, who's wondering about prescription medical cannabis coverage. She says it is bonkers to have opioids covered, but yet the safer alternative taxed twice and charged out of pocket. Where do the parties stand on prescription medical cannabis and Pharmacare?
So let me give a caveat. I'm not an expert in cannabinoid prescriptions or cannabinoid medication, so I can't comment specifically on that. But what I can say is that any element of a successful national public drug plan must have evidence-based prescribing and evidence-based medication. So what that means is when a new drug comes onto the market, whether it be cannabis or anything else, that the public plan will only pay for it if it actually provides added benefit versus something that's already out on the market. What we see right now, private drug plans don't have the same incentives to reduce costs. So when Health Canada approves a new medication, even if it's not better but more expensive than a current one, they'll cover it. Public drug plans are much more circumspect and, in my opinion, take a much more thoughtful approach to what they choose to cover, but also what they choose not to cover.
Okay, so give me an example of that before you go, Dr. Raza, of what you're talking about. The private plans obviously want to do it in the most cost-efficient way. So why are they rushing to use that particular drug or what have you, supplement?
Yeah, so it goes back to looking at the business model. So the predominant way that private insurers make money is they basically get a cut of the overall cost or volume of prescription drugs. So I don't know the exact figure, but let's say they get 10% of the overall cost of General Motors or the University of Toronto, their private drug plans. That's how they make the bulk of their money. So the more medications that are prescribed and the more expensive the medications, the larger the revenue
back to the insurance company.
Right. Whereas public drug plans, they have greater accountability to the public, just like with hospital and physician services. And there's already the infrastructure in place to use the best available scientific evidence to pay for medications that actually work, and only pay for the ones that are better than the ones that are already being prescribed.
All right. Dr. Raza, thank you so much.
Thank you, Carole.
Dr. Daniel Raza is the chair of the Canadian Doctors for Medicare and a family doctor in Toronto, and he joined us here in Toronto.